Throughout Doc and the D, I've shadowed many of our incredible employees at Henry Ford Hospital, and today, of course, is no different. In honor of Nurses Week, I hope to showcase the talent of our nursing team at Henry Ford Hospital. During this edition of Walk in My Shoes, I shadow not one, but 3 nurses. One an inpatient nurse, one an outpatient nurse, and one intensive care nurse. My hope is not only to showcase the nursing team, but highlight some of the similarities and differences within their nursing units. I've been given the opportunity to shadow Vince Lehmann, the nurse manager of the pain clinic, Andrea Monroe, nurse in general medicine, and Bob Stine, charge nurse for the surgical intensive care unit. I thoroughly enjoyed my time in the units, learning more about what they do, and I'm looking forward to hear more about what they do today. One of the things that I think is great about the nursing profession is the different expressions that you can have in the field. Obviously, the 3 of you are in very, very different areas, all with nursing at its core. But it allows you that kind of latitude to do different things.
When I came here as a nurse, I never realized that I was going to have all this other interest. I really enjoy the business side of it. I never thought that I was going to enjoy like this project management stuff, and I really get excited about project management. I get excited about, you know, Columbus Center opens on May 7th, and I've been blessed with being able to be there when the drawings weren't even on the table yet. You know, every day I try to come out and see a couple patients and just see what the visit's been like, and to have some interaction and see what's gone well for you today, what's not gone well.
How many times do you hear, say, a year?
Probably 80 to 100.
So the visit here with the nurses and the physicians, how was that today?
Above reproach. I wouldn't go anywhere else but with Henry Ford.
So let me ask you, Vince. I mean, you run a very busy service in our pain clinic, and if you could tell us what kind of role that scheduling and project management plays in your day-to-day work.
You know, every day we're looking at our schedules, and main campus does a good job of plugging the right people into those schedules every day, you know, trying to maximize our efficiencies, making sure our patients have good access. So that's a big part of my job, is just getting that access, getting patients in as quickly as possible, you know, accommodating them whenever they can. So that's a big part of what I do. In the project management, there's all kinds of different things for project management. It can be as much as launching the Columbus Center that opens Monday, to process improvement. How do we, you know, improve our inpatient, outpatient pain scores? You know, there's all kinds of different projects that are always going on to improve the service.
So I know that you see patients quite frequently. You know, they're not just being seen once, right, but coming back to the clinic. How does that affect the relationship that you have with them?
Well, we have a really good group of patients that come back. Some of them are challenging, I guess, like in any department and anywhere that you go. We've developed those relationships over time. Patients begin to trust us to help us with that pain and improve that pain and make things better for us. So we really, you know, we've had patients that are very difficult, but as they've come through our system and we've been able to help them and they build that trust with us, they've become really part of our family.
My pleasure.
She selected me, and I said, little me, you know, but honored.
And we're going to start. We're going to discuss your care, okay? The plan of care, what they're going to do for you today. And I know you're on the heparin drip because after the CAT scan, what they found on your lungs.
Right.
Okay, so you know what's going on with that, right? You can have a seat.
She's kind. She's gentle. She's smart. She's everything, and she's a beautiful lady.
So she's everything a nurse should be, right?
Yeah, but also the people that follow you on second and third shift.
Yes.
You got some wonderful,
Thank you.
dedicated people.
Appreciate that.
Thank you.
Thank you.
The doctors really collaborate with us. And you know, usually they always check with the nurse, see if the patient condition, anything has changed. It's usually nurses.
Yeah, that's a big thing that we're really trying to stress, is obviously team-based care and communication amongst the team, as well as communication with others. I think that's the key to great care.
Great patient care and great patient outcome, keeping our patients coming back.
I could see it a little bit when you're talking to patient, is that the other key is relationships.
Yes.
And you're very warm and explaining things. And,
yes. You have to let the patients know that you're here for them and that you care for them and that they're in great hands when they're here at Henry Ford Health System.
Yeah.
And that's how my patient feels.
Andrea, we met a patient when we visited you on the floor who had the opportunity to go to many other hospitals than Henry Ford. And how does that feel to know that patients choose Henry Ford because of your services?
It made me feel real good that this patient chose to come to Henry Ford Hospital and could have gone to several other hospitals, but he chose to come to Henry Ford. He had the patient had good things to say about Henry Ford, the care he got, all just wonderful things, to say. So that really made me feel good that I was doing my job to make this patient really have those type of feelings about us.
We saw a patient that during your visit you interacted with one of the physicians and showed how collaborative practice works effectively on the floor. Tell me a little bit about that and how you view that as positive, or you view that as necessary for excellent patient care.
As a nurse, we have to collaborate with the physicians, the pharmacy, everybody that plays a role into making sure that that patient is getting the best care that they deserve when they come to Henry Ford Hospital, making sure we're communicating with the doctors. It might be something that the doctor picked up that I didn't pick up, or vice versa, that the nurse saw, and then it's best to let that doctor know that something is going wrong with that patient, so that we're making sure we're giving good care to our patients.
How long would it take for a nurse to become pretty proficient at being able to manage these patients?
Yeah, well, we go ahead and give a good orientation to them, and we flex the orientation based on their needs. Some of them are coming with experience and some of them are not. Usually it takes a year kind of coming in, getting the feel of what the ICU and the protocols that we have here at Henry Ford, which are really good. You have a lot of autonomy here.
Right.
You're able to go ahead and do things independent. You have you have lab work that comes out. You can go ahead and act on those based on protocols that are actually stated. So it takes we're looking at about a year to get kind of very comfortable in the role. Today we have a liver transplant coming. So what we need to do is go ahead and, we're full, right? So we have to coordinate the idea of getting a patient out of the unit in order to go ahead and get that patient in. The patient is going to start about 5 o'clock. It's as charge nurses, we kind of gauge the surgery as to how long it's going to take. Usually liver transplants take about 5-6 hours to go ahead and complete. So we know the timeline in which these patients with repeat procedures are going to do.
Bob, you're in a very specialized area in the intensive care unit. How long does it take for a nurse who's not had experience in the intensive care unit to really become fairly proficient in being able to care for the sickest of the sick patients that we care for?
Yeah, that's what's good about Henry Ford too. It's an individualized orientation, and with that individualized orientation, some people may have some backgrounds that maybe they're working in a clinic, maybe they were working on the floor, and then they have a desire for the intensive care unit. Usually it'll be a couple months, 3 months before they're done with their orientation, 8 weeks to more depending on their needs, and then after that. It takes a good year to really feel a comfort zone and knowing all the ins and outs of how to take care of that critically sick patient.
Well, being an old intensive care physician, and I don't want you to really fixate on the term old when I say that, one thing that I know is that we're always trying to get patients into the intensive care unit or getting patients out of the intensive care unit. It's a resource that's always highly valuable. Can you tell us a little bit about the bed management activities that you do, Bob, and trying to make sure that patients get out of the OR in recovery and out of the ER and really are able to manage those patients effectively?
That's basically a lot of my role is to the coordination of that care and making sure that when a patient is needing either from the ER, from the OR, or from the floor, a patient goes bad on the floor, we need to make sure that bed's ready. So we have different strategies that are made available to us. We work closely with the physicians. In the surgical intensive care unit, the surgery services divided into different specialties. And what we do is, what I'll do is go ahead and have active conversation with those individuals and say what patients do you think that can go out, and then they'll go ahead and help me to assist me in making that happen.
So I'm a relatively new CEO to this job. So if you were in my shoes, from your perspective, what kind of advice would you give me? What do you think I should be doing?
I thought about this, but I think that and I'm not just saying this to make you happy, but I think you're doing a really good job. You're very focused on this campus and making sure that we're doing all the best in practice things. I mean, it's just challenging for you to make sure that all your team and all the leaders and all of us do what and what's in your heart is right. It's just I think you just got to keep on doing what you're doing.
You keep it in touch with the people on multiple roles, like you were doing. Like I saw that last one where you did the walk in the shoes with a lady from the OR. That actually shows me that you're not the role that you have is really important as part of the team. And no matter what that role is, I'm going to find you and I'm going to hear you. And if you hear the ones from all the area, then you're going to get a better picture and a better pulse of what are the needs of the hospital. And I do appreciate that.
Just keep on doing what you're doing. Like you started the rounds. I got a lot of feedback from my staff on my team. They really enjoyed when you came down and visited them on the unit. So, because some people were saying, a lot of people say, "Who's Dr. John Popovich?" So I don't know who that is.
I've asked that question of myself, actually.
So a lot of people now, they know who you are.
Hospitals are really determined by the quality of the nursing staff of the hospitals. There's no question in my mind that is a huge differentiating factor. And we're very fortunate at Henry Ford Hospital to have great nurses such as the three of you. And I really want to thank you and thank you for representing the rest of the nurses of Henry Ford Hospital and the rest of the nurses for Nurses Week. We're so fortunate, as I said, to have you part of this. And again, I think you're great ambassadors not only for nursing but also for Henry Ford Hospital. Thank you.
Thank you.